Need to know cardiovascular patients across our region now have new resources and improved access to medical care. It comes after the closure of a major medical center in Atlanta. WSAV's Daisy Kershaw has a closer look.
If you look across the entire country, cardiovascular disease remains the #1 killer of men and women of all ages.
Each year, more than 800,000 Americans die from cardiovascular disease. Now, state leaders and health officials have a plan to reduce the number of heart-related deaths in Georgia.
We were sort of in the lower third of the country when it came to mortality related to cardiac emergencies. And that's when the leaders at the state level in the Department of Health decided, well, we need to do some things to try to make improvements across the state so that Georgians aren't dying at the rate that they're dying of heart disease.
Through a new system of identifying standout care in cardiology, officials are helping make sure patients get the best care. Just last week, Memorial Health's Heart and Vascular Institute was given a top distinction in the field.
We're the first one in the region to do that, and one of the very first in the state to achieve that designation.
Memorial Health is now a Level 1 emergency cardiac care center, which means improved access and treatment options for heart patients in our region.
As a Level 1, there are 3 levels. Level 1 deals with the highest acuity and sickest of the cardiology patients that we see here in the region.
This designation means more resources available to those they care for.
The different levels really have to deal with the availability and what resources each facility has at their disposal. Having on-site and 24/7 availability of not only cardiology and cardiology services here in the cath lab where we stand, but also all of our surgical services, our support when it comes to heart pumps and things that people may need emergently to help them to survive.
Daisy Kershaw, WSAV News 3, on your side.